Thank you very much, Lisa. Hi guys, my name is Jacob. I would now like to highlight how different health sectors, including federal and state government supported, private, and civil society, impact asylum seekers in negative and positive health aspects. I will discuss some health issues and the health sector's impact on health outcomes, health sector strategies for people while in detention, and for individuals in the community who hold visas prior to being granted refugee status. Asylum seekers are one of the most marginalised groups, particularly in the health sector. In recent years, government and civil sectors have taken measures to improve health systems in Australian detention processes that have previously had a negative impact on the stigmatised group. Although government health services are provided in detention centres, detention itself is a Western policy of deterrence that can negatively impact on the health and well-being of asylum seekers by marginalising them from the rest of society. One systematic review highlights that these Western policies are similar to one another in the way they reduce access and availability to healthcare services, education, and employment for asylum seekers, which results in a negative physical and mental health outcomes. Australian Medical Association identifies poor dental hygiene, poor nutrition and diet, and infectious diseases as physical health issues of asylum seekers. In Australia, implications for people seeking asylum include the limited access to external healthcare while in detention, a problem government services are attempting to overcome. While asylum seekers are detained pending processing to gain refugee status, they are only able to receive on-site healthcare provided by international health and medical services. IMHS is contracted by the Commonwealth of Australia to provide physical and mental health care within the Australian Detention Network, in a manner comparable to Australian public health standards. One highly detrimental health issue asylum seekers face in detention is negative mental health outcomes, an issue the IHMS is prioritising to overcome. One suggestion by the Royal Australian College of Physicians is that asylum seekers should be offered a voluntary assessment of their physical and mental health, including assessment of acute or chronic medical conditions, developmental issues, and disability. The IHMS states that current methods provide assertive outreach and early intervention programs to improve detection of mental health problems to enable more effective intervention. Non-government organisations such as the Red Cross provide humanitarian perspective to these government health services with a focus of observing the conditions and treatment of people in detention to ensure that their health, dignity and well-being is being upheld and protected. To ensure effectiveness and impartiality to political agendas, the Red Cross performs frequent monitoring of immigration facilities in both Australian and offshore detention centres. As Robijant et al. Describes, the past treatment of people in detention has created high levels of emotional distress, identifying behavioural problems, anxiety, depression, and post-traumatic stress disorder as health outcomes. This approach by the Red Cross aims to improve healthcare and treatment of people in detention facilities to improve outcomes.